Hello, this is Dr. Morris. I'm doing a review for the A&P2 class. This is the first exam. It's the lecture and the lab exam. This is a review. It will cover the cardiovascular system. This is for course BSc 2086.050 and .001. Also for BSc 2086 L.050 and .001. I will begin with the lecture portion of the examination and then move to the, I will begin with the laboratory portion of the examination review, and then I'll move to the lecture portion of the examination review. These are illustrations taken out of your textbook along with a gross anatomical photograph taken out of your textbook as well. Some of the structures I would easily ask you to be able to identify on the laboratory portion of the examination. I would expect you to recognize this chamber of the heart. This is the right atrium of the heart. I would expect you to recognize this portion, the auricular portion of the the auricular portion of the right atrium of the heart. So I would expect you to recognize that. I would expect you to recognize some of the great vessels of the heart, the superior vena cava. I would expect you to recognize this structure. Would expect you to recognize the aorta arch. This is the pulmonary artery, recognizing that the pulmonary artery carries deoxygenated blood from the right ventricle of the heart. This is the apex of the heart. This would be considered the apex of the heart. This is some of the pericardial fat in the major sulcus of the heart. In this gross anatomical picture, easily you can recognize the auricular portion of the right atrium of the heart. You can also appreciate the aorta. You can also appreciate the apex of the heart. Probably I won't, other than asking you perhaps if this is a coronary artery, there's on the gross anatomical portions of the heart, those are probably the only structures I would be able to ask you because of the clarity of the picture. This is a histological slide of cardiac tissue. Now, if you recall from A&P1, there are some similarities between cardiac muscle and skeletal muscle. First, they're both striated. However, there are some major differences. Number one, if you notice, this cardiac muscle is has branching fibers. Also note these key structures, which I would be able to ask you to identify. These are intercalated disc. Intercalated or intercalated disc are basically intracellular connections. They allow electrical conduction to pass from one cardiac cell to another. So this is cardiac tissue. These are intercalated disc. Please note the branching pattern. I may ask you physical characteristics. List 3 physical characteristics. You could say striation. You could say intercalated disc. You could say branching muscle fibers. This is cardiac tissue. Now, this photograph represents an illustration of the heart. As you see, the heart's been sliced, giving you the posterior portion, or at least giving you a view of the portions of the heart, the posterior walls of the heart. But it also allows you to see inside the chambers of the heart and inside the great vessels. Let's start with some structures that I may ask you to identify. I might ask you to identify the superior vena cava. May ask you to identify the inferior vena cava. I may ask you to identify this as the chamber of the right atrium. I may ask you to identify this small circular structure. This is the fossa ovale. The fossa ovale. You should be able to identify this structure. Remember, this is a patent during childhood, during embryonic development. This is a patent hole between the right atrium and the left atrium, and it allows blood from the right atrium to bypass the lungs and enter directly into the left atrium. Now, this is because blood, while the baby is in embryo, blood comes from the mother, is already oxygenated, and the lungs in the baby are not developed, so it's no need for the blood to go into the right ventricle, into the lungs, because the lungs aren't functioning. So a bypass naturally is created in the developing fetus to allow this to occur. You should be able to identify this chamber as the right ventricle of the heart. You should be able to identify these tissue areas here as trabeculae carneae. You see it also in the left ventricle as well. You should identify this conical shaped structure as a papillary muscle. Papillary muscle. Would expect you to be able to identify that. Would expect you to be able to identify these string-like structures as chordae tendineae. Chordae tendineae. And as you can see, they attach to the tip of the papillary muscle, and they this atrioventricular valve or tricuspid valve that's located here opens and closes. The papillary muscles control that motion. Also, please note the intraventricular septum. Intraventricular septum, thicker septum than we see in the atrial septum. The atrial septum is not that well developed because it is not under the significant muscular contractions as the left ventricle are. So you see here the intraventricular septum. Should recognize also the major blood vessel leading out of the right ventricle. This is the pulmonary. This is the pulmonary trunk. The pulmonary trunk leads out of the right ventricle, and it divides into a number of arteries, the pulmonary arteries. And again, the pulmonary arteries carry unoxygenated or deoxygenated blood to the lungs. This is the only artery in the body that carries deoxygenated blood. So again, out of the right ventricle, the pulmonary trunk. Pulmonary trunk divides into the pulmonary arteries carrying deoxygenated blood. You should recognize the valve that's located here. The valve of the pulmonary vein has three cusps. These are the semilunar valves of the pulmonary artery. You should recognize the great vessel, the aortic arch. Moving over to the left side of the heart, we have the left atrium, and then the very thick and prominent left ventricle, trabeculae carneae, papillary muscles. Now the valve here is referred to as the atrioventricular valve, but I don't want that name. The name I want here is either the mitral valve, that's the best name to give it, or you can call it the bicuspid valve. So you should be able to recognize these structures. This is a gross anatomical picture of the same. Again, you can appreciate the intraventricular septum. You can identify the chordae tendineae. You can identify the papillary muscles as you see here. But those are pretty much the only structures I would be able to ask you off of this gross anatomical structure, and again, because of clarity. Three names of the following structures refers primarily to these valves. I do expect you to know this as the atrioventricular valve. I do expect you to know it as the bicuspid valve. The other name is the mitral valve. So you should know all three of those names. Again, if I ask you to identify a structure in the right atrium, this is called the moderator band. The moderator band. I would expect you to be able to identify that structure. These structures here are trabeculae carneae. This is a papillary muscle. These are chordae tendineae. Specific structures located, or specific muscle located in the left ventricle. This was asking for these papillary muscles that are located here. Finally, I just want to review the circulation, blood as it enters into the heart. You should be able to follow the path of blood throughout the cardiovascular system. We start with both the superior and inferior vena cava, both which lead into the right atrium. The right atrium receives the blood. Blood is then passed through the atrioventricular valve, or the tricuspid valve, into the right ventricle of the heart. Inside the right ventricle, blood will then be forced out through the pulmonary artery. These semilunar valves will open up. Blood will then pass into the lungs. Inside the lungs, the blood will receive oxygen. There's an exchange that takes place between CO2 and oxygen. Oxygenated blood will then come back into the left atrium. Blood will then leave the left atrium and then move into the left ventricle of the heart. And then from the left ventricle, it is pumped into the aorta and into the system. Okay, that being said, I'm now going to continue the review for the lecture portion of the exam. The lecture portion of the exam, again, will cover the cardiac system. There are a total of 55 questions on the exam. I do expect you to be able to identify the epicardium, the pericardium, the myocardium, and the endocardium. I'll repeat those: epicardium, pericardium, myocardium, and endocardium. You should know the locations of these different layers of tissue of the heart, and you should know their basic characteristics as well. You should know the physical characteristics of the ventricles, be able to compare and contrast the right ventricle versus the left ventricle. You should know what's meant by the term visceral pericardium, and where it's located at. You should know the general characteristics of cardiac muscle. For example, cardiac muscle does not require nerve activity to stimulate a contraction. It's an autorhythmic muscle. So you need to know the physical characteristics. I already reviewed the histological structure, striations, the branching muscle fibers, the intercalated disc or intercalated disc. You do need to know what an ultrasound evaluation of the heart is referred to. This is an echocardiogram. Again, I see several questions related to epicardium, pericardium, myocardium, and endocardium. So I'm skipping some of those. So you should really focus on knowing what those internal layers of cardiac tissue are. Again, remember that cardiac muscle is striated muscle. It is involuntary muscle. We have no control over how the heart beats. The muscle also contains intercalated disc. You need to know the valve that exists between the right atrium and the right ventricle. What is the common name that refers to those wipes? You need to know where the tricuspid valve is located at and its characteristics. You need to know where the aortic valve is located at and what its characteristics are. Again, compare and contrast the right ventricle to the left ventricle. Again, you need to be familiar with all of the names of the left AV valve, the right AV valve, any of the other valves. You need to be fully aware of the names of all of those different valves. Okay, you should be able to identify the different valves in the heart. You should recognize what the valves that lead into the pulmonary artery are called. You should know the different names for the valves, the atrioventricular valves. Remember, the valve on the right side referred to as the tricuspid valve. On the left side of the heart, the AV valve is called the mitral valve or the bicuspid valve. And so you should be able to identify each of those names as well. Again, you should be able to identify the different layers of the heart tissue: endocardium, myocardium, and epicardium, and you should be able to list those either from beginning at the deepest tissue layer to the most superficial tissue layer, or from the most superficial tissue layer to the deepest tissue layer. So you should know those the correct layers of the heart. You should know the definition of ischemia, I-S-C-H-E-M-I-A, ischemia. You should know the definition of infarction, I-N-F-A-R-C-T-I-O-N, infarction. Should know the difference in those two. Again, you should be able to trace blood as it enters into the heart from the superior and inferior vena cava into the atrium, and you should be able to trace that blood all the way through the heart. There are several questions that will ask you or will identify a location where the blood is at, and then where the next step the blood will travel to. So you should be able to take blood into the right atrium of the heart and take it all the way out to heart, where it pumps out of the left ventricle into the aorta. So you should be able to trace the blood. You need to know the role and function of the chordae tendineae. The role and function of chordae tendineae, where in the heart chordae tendineae would be found. You need to know what blood vessel takes blood into the lungs from the heart. You should be able to identify the conduction pattern of the heart, what is called the pacemaker of the heart, where does electrical activity pass, leaving from the SA node to the AV node, and then where it travels at through the heart. You should know where the bundle of His is located at. You should know where the Purkinje fibers are located at. Again, you should be able to follow that electrical impulse starting at the pacemaker of the heart at the SA node and take it all the way through the heart. You should know what the heart rate of the SA node is, what it's measured at. You should know what the heart rate of the AV node is measured at, typically. You should be able to identify the QRS complex. Now, I will not ask you any questions about specific arrhythmias. I will cover that in the next portion of the lecture series, but you should recognize and identify what the QRS complex is. You should know what the QRS complex represents. You should be able to identify the P wave. You should be able to tell me what the P wave is indicative of. You should be able to identify the T wave, and you should be able to tell me what the T wave is indicative of. You should be able to tell me what the cardiac output is of the heart, and what two factors determine the cardiac output. You should be able to tell me you should be able to tell me what the definition of tachycardia is. You should be able to tell me the definition of bradycardia. You should know what the I'm sorry. You should know what the definition of valvular stenosis is. Valvular stenosis, S-T-E-N-O-S-I-S. You should know where the auricle of the heart is located at. Remember, I showed you on the atrium where the auricle, A-U-R-I-C-L-E, where the auricle is located at. You should know the difference between the systemic circuit and the pulmonary circuit. The systemic circuit and the pulmonary circuit. You should know the effects of serious arrhythmias on the heart. Typically, when a serious arrhythmia strikes the heart, usually it will somehow affect the cardiac output, so it certainly will cause interference in the movement of blood through the heart. So you should be somewhat familiar with what serious arrhythmias can cause. You should know the factors that cause serious arrhythmias. Usually it's related to damage to the heart muscle itself. It may be an injury in the conduction system. It may be related to various abnormalities in concentration of electrolytes, such as abnormalities in potassium levels or sodium levels. All of these can cause serious arrhythmias and lead to a compromise in the pumping efficiency of the heart. So should be familiar with that mechanism. You should know what the moderator band is. You should know where the moderator band is located at. Again, you should be able to follow the electrical conduction through the heart, starting at the SA node, going to the Purkinje fibers. You should know what the stroke volume is. You should know what the cardiac output is, and what factors make up those two agents, stroke factor, the stroke volume, and the cardiac output. You should know what vessels in the heart carry oxygenated blood and what vessels carry deoxygenated blood. And I believe that covers all of the information that will be on the next exam. Good luck studying. Thank you very much.